A colleague of mine told me a story of this young couple that came to the hospital with complaints of infertility. And they had been married for 2 years and were worried that they had not been able to conceive a child. They were living together and having frequent intercourse. And yet, not even 1 month of missed period. The wife was always having her monthly flow. So they decided to see a doctor. They had different sessions with the doctor, did different tests, and after the whole checks, nothing was found to be wrong. Hormones, general body system, everything was normal. The man was all right. His wife was equally healthy. So the couple was advised to take some time off work and travel to some other place for holiday. Well, they took the advice, traveled and spent some weeks on a holiday and came back to base, continued with their normal lives and their usual work life and all of that. After 2 months, the wife noticed she had missed her period. They were pregnant. Dr. Juliana Ome is the name, and my question for you is, what if as a couple, you may be thinking you have infertility? Meanwhile, the problem is just anxiety or worries. Well, today, I'm going to educate us on infertility, the basic knowledge we need to know that could be of help to us, as well as the common mistakes couples who are expecting to have their own biological children make. Now, let's do this together. Infertility is when a man and a woman are not able to achieve pregnancy after 1 year of regular, unprotected sexual intercourse. Before a couple will say they are infertile, they must have lived together with proper, unprotected sexual intercourse for at least 1 full year. Infertility affects millions of people all over the world, and it can either be primary infertility or secondary infertility. Primary infertility is when a couple has not successfully achieved pregnancy for the first time, despite unprotected sexual intercourse. While secondary infertility is when they had pregnancy in the past, whether or not that pregnancy was carried up to 9 months. For example, the wife got pregnant maybe 8 months after wedding and then had miscarriage. And then 2 or 3 years after that, no pregnancy at all. Or it may even be that the pregnancy was carried up to 9 months and she delivered the baby. Now that child is 10 years and yet no other pregnancy, despite all their attempts to take in. That is an example of secondary infertility. When couples come to the hospital with issues of infertility for the first time, most of them are usually worried, mostly because they are not sure of what to expect or the outcome of their visits. But I assure you that knowing the exact problem gives clarity and a direction to getting help, and also a hope for a solution. So in today's health talk, we shall look at the likely causes of infertility and what to do when you're still expecting to achieve pregnancy as a couple. Infertility can be caused by different things: male factors, female factors, combination of male and female factors, or it may be due to an unexplainable factor. What this point means is that sometimes it's not possible to explain the causes for a couple's inability to achieve a pregnancy. But before we explain the causes of infertility, let's understand how a baby is formed. Understanding the process of fertilization will help us know the likely causes of failure to become pregnant. In the female reproductive system, there are 2 ovaries where the eggs are produced every month. Then the fallopian tubes where the egg will pass through to enter the womb. Then the womb itself and the cervix and vagina. Every month, the woman releases an egg from her ovary, and this time of the month is called her ovulation time. The egg will go to the fallopian tube and stay there for some hours, waiting for the sperm. If sperm does not come to the egg will come out later as menstruation. But if there's a sperm, then fertilization occurs and baby starts growing. Every female already has a total number of eggs she will release throughout her lifetime, right from when she was a baby in her mother's womb. So if a female baby is born today, she has a total number of eggs she will use for her lifetime in their immature states. By the time she gets to puberty, the immature eggs will start maturing and she'll be losing the eggs in numbers. So as a woman grows older, her number of eggs reduces and her chances of achieving pregnancy will also reduce. every step in the monthly release of egg is controlled by hormones. Hormones are chemical substances that tell the body what to do, and these hormones are produced in the brain as well as in the ovary. The hormonal system works like the traffic light system. There's a red signal that says stop, and then the amber or yellow light system that says wait or get ready, and then the green light that says go. So in a situation where the hormone in the body is giving a red light, which is the stop signal, without ever showing green signal, which is go, a couple can be doing everything right, but fertilization will not take place because the hormones are giving out the wrong signals. And that's why hormonal assays, hormone tests, are very important in these issues of infertility. So at intercourse, the man releases semen at the vagina, and the semen release contains millions of sperm cells, millions of them, and all these sperm cells will swim through the womb of the woman to the fallopian tube to meet with the egg and fertilize it. When they are swimming through, some of them will die on the way, some of them will get distracted and swim to another direction. Different things will happen. The first sperm cell that gets to the egg is not necessarily the one that fertilizes the egg, but the first sperm cell that is able to penetrate the egg, that enters the egg first. So all of them might get there, and some of them will be busy looking around, doing tourism, while some just go straight for the egg. So that one that enters the egg first is the winner of the competition. And once any sperm cell enters the egg, the two of them will unite and baby starts growing as a single cell. This single cell will then travel through the fallopian tube back to the womb, where it will grow for 9 months until it becomes a full baby. So a healthy and good number of sperm plus free and smooth female reproductive system plus correct hormone signals plus frequent unprotected sexual intercourse is called fertility. For the male factors, in the male reproductive system, things that cause infertility are things that will affect sperm release and the quality and amount that will be released. For example, low sperm count. There are too many causes of low sperm count. Unhealthy sperm, sperm with low motility or low speed. The rate at which the sperm cell move is very slow. That's a problem. Or what we call morphology problems, sperm cells that are not well formed, or lots of immature sperm cells. Also, when there's erectile dysfunction, or when sperm is not released properly. This is called retrograde ejaculation. This can also contribute to infertility, or when a man has hormonal imbalance. Then conditions like undescended testes. Now, when a baby boy is born, the testes are supposed to be outside the body. Okay, now this is what the testes looks like. But if a baby is born and testes are trapped inside the body and left there for years, it will cause infertility because the best environment for the testes is a cool temperature, and the temperature inside the body is hot. That's why God made them to hang outside the body where they will be cool, and the man's testes will be in a good state to produce sperms. So if the testes remain inside the body, it can cause infertility. So exposure to heat around the testes is a problem, like men who drive for long distance, or those that wear tight and nylon material underwears all the time. This can contribute to overheating the testes and subsequently infertility. Then disease conditions like mumps during childhood can also cause infertility. While in the female reproductive system, starting from the cervix down to the fallopian tube, anything that blocks free movement of the sperm when traveling to meet to the egg and fallopian tube can cause infertility. Now, let's start with the ovaries. The ovary is a sac that holds a woman's eggs, and they are 2 in number. Every month, the ovary should release at least 1 egg. Conditions that cause lack of release of egg has automatically caused infertility for the woman, because if there's no egg, then there's no way baby can be formed. And things that can cause a woman not to release egg can be diseases like polycystic ovary syndrome, premature menopause, hormonal imbalance, or removal of the ovary. Maybe the woman had tumor when she was young and they had to do operation to remove it. So there's no way egg will come from. So these are things that can contribute to infertility. Now to the fallopian tubes. The major problem that can affect a woman's tube is blockage of the tube. In real life, the fallopian tube is like a narrow cord with tiny hair-like things inside to help move the egg or the sperm, or to move the both of them after fertilization. Once the tube is blocked, or the hair inside the fallopian tube is stiff, it's not soft as should be, Egg cannot travel back. Even when the sperm manages to swim through to fertilize the egg, they will not be able to come back after fertilization. And that can lead to infertility. And one thing that can easily cause blockage of tube is sexually transmitted infections, pelvic inflammatory disease, PID, especially from gonorrhea, chlamydia infections. Another thing that can affect fallopian tubes can be complications from abortion or any surgery operation around the tube. There are two things a normal womb should be. It should be empty and it should be smooth. Any condition that affects these two factors can cause infertility, like adhesions inside the womb. Adhesions means gumming together of the womb. Maybe someone did abortion with some instruments and may have caused injury inside the womb. So the womb will heal by gumming together. Another thing that can affect the womb is fibroid. Fibroid can stay inside the womb where a baby is supposed to be, or it can affect the space where the sperm is supposed to swim through. And that can make a woman to be infertile for years. But not all cases of fibroids cause infertility. Sometimes a baby and fibroid will stay together in the womb and grow together. Another condition that can affect the womb is malformed womb. And this happens when a baby is growing inside her mother's womb. So if a female child has a malformed womb, you will not know until when it's time for her to have her own children, then to be noted. Example of a malformed womb is what we call septate uterus. Now to the cervix and the vagina. These two should be moist and free for sperm to swim through. But when there is dryness of the vagina or the cervical mucus is too thick, this can affect the sperm cell when they try to swim through. Or when the vagina is too acidic for the sperm, it can cause them to die off before they even get to the egg. Sometimes things people apply or lubricants can be causing harm for the sperm and killing most of them. So one has to be careful. Now to the combined factors, there are issues that cause infertility in both male and female. Age. Age is a factor. Fertility drops as one gets older, both for the man and the woman. Occupation like stressful jobs, for example, a woman who is an athlete, a man who drives long distance. Or habits, excessive drinking of alcohol or smoking or use of drugs can affect fertility. Smoking and alcohol can weaken the sperm of a man and cause malabsorption of some vitamins that the body will require to increase chances of pregnancy, both in the man and the woman. And again, women who smoke cigarettes are at risk of infertility because there's a chemical substance in cigarettes that causes the tiny hairs in the fallopian tube to be stiff. They won't be soft like hairs. And this can affect the rate at which the sperm can swim to meet to the egg. Lifestyle. Inadequate diet, eating improper meals, which can lead to too much weight or obesity, or even excessive weight loss or too much exercise. This can make the body to give out wrong signals. The hormonal system will give out wrong signals, and then the body will not be informed properly on what to do and when to do what to do. And there are some toxins in the environment that can be harmful to a man's sperm or a woman's egg. Something like heavy metals, like lead and all that. Working in some kind of industries. Anything in this category can reduce the quality of sperm and egg as well. Now, there are many causes of infertility. And what is the cause of infertility in one couple may not be same in another couple. Now, let's look at the common mistakes couples make while wishing to have their own children. Number one is lifestyle. Engaging in harmful behaviors like we stated earlier, too much alcohol, smoking, unhealthy eating habits, unhealthy body weight, too much fat, both for the man and the woman. This is a problem. As a couple with infertility, the best thing we can do individually and as a team is to keep a clean body system and remove all harmful habits, and your chances of achieving pregnancy will automatically increase. Waiting for too long after getting married. Please, age is a factor for a man and a woman. As a woman, you get married and you decide to wait for 5 years before you allow pregnancy. That is a risk because as a woman grows older, the number of eggs in her ovaries will reduce. Another thing is delay. Delay in seeking help, delay in accepting the diagnosis, delay in starting care. Remember this. The younger the age of a couple, the faster it is for pregnancy to be achieved. I've said this a lot today. So please, once you make up your mind to seek help, don't waste your time, okay? Just start up with your care, all right? That's it. Another mistake is assumption. When a couple starts thinking that maybe possible mistakes they made in the past will be the cause of infertility, that will cause a problem. Because when dealing with infertility, there should be no assumptions. Sometimes the problem is not even what you think. Like the story I shared with us at the beginning. It may just be anxieties or, long period of stress or slight hormonal imbalance. So you cannot just sit at home and say, oh, because I did abortion or because I did this and did that when I was younger, so I can't have a child. No, come out. Come out so you can get some help, okay? Another mistake is throwing blames. Remember, it takes two to succeed with fertility. Working as a team gives you a better result and at a faster rate. If the doctor says the problem is for one person, that's not the time for the other person to start blaming the partner or start fighting and quarreling. The best thing to do is to support each other and get a solution. Another mistake is setting timetable for sex. Nah. Sex is supposed to be spontaneous and natural, okay? It's supposed to just happen, except you're trying to track ovulation day. No need to put a timetable. Instead, you're advised to target sex at least 3 times every week. Try as much as possible to not worry about the problem. Take your mind off the problem and then focus on the fun and enjoy the intimacy. You yield a better result than when you're looking at, oh, today is Monday, let's go. Today is Wednesday, let's go. Oh, today is Saturday or Sunday, let's do it again. No, it's not the best. Just, enjoy your intimacy. Another mistake is impatience. Some couples abandon their treatment plan halfway and just go because they are tired of the testing and the frequent hospital visits. Remember, the body is like a complex machine. It requires time to gradually check the various parts and know where the problem is from. So please don't be in a hurry and don't abandon the ship halfway, okay? Just be calm and you will get solution. Very real for couples hoping to become pregnant is the overbearing frequent hospital visits, huge financial bills, failure of treatment, and so on. The process can be psychologically draining. I encourage you to please try a little more. You may just succeed with the very next step, okay? Another mistake is comparison. Some couples are discouraged because they compare themselves to another couple. Although a couple may have infertility, but they achieve pregnancy with just 1 or 2 hospital visits, while themselves are still going to the hospital for years. Remember, what may cause infertility for couple C may require just few medications for hormonal imbalance, while what will be responsible for infertility in couple A may require sperm donor or even an egg donor. So don't be tempted to compare yourself in any way with others. Just don't worry. You will also have your own babies, okay? Another mistake is thinking that getting married as a virgin means you should not be infertile. That is an error. Now, when you marry your partner or both of you marry as virgins and you express infertility, please do not sit down feeling like because you abstained from sex before marriage, pregnancy is a must. No. Abstaining from sex before marriage is beautiful and it reduces problems like blocked tubes, injured wombs. You don't have all those kind of problems, or doing abortion. Things like that are not part of your story. But there are also other problems like hormonal imbalance. So please seek for help the moment you're not succeeding with becoming pregnant. Don't just say, we are virgins, so everything is perfect. It's okay, but just seek for help and do that fast. Finally, the mistake of lack of trust on medical advice. Sometimes you give a couple advice on what to do and they just don't bother doing that because they doubt the effectiveness of that advice. No medical advice will be given to you if it is not effective. So learn to trust your doctors and what they tell you, because you need to be convinced in your mind to get the result that we are expecting. If you have ever visited the hospital for infertility issues, you will notice that there are so many questions to answer, especially on the side of the woman. If you're trying to get medical help for infertility and you're watching this health talk, then you should start now to put your information together. The more accurate your answers, the easier it is for your doctor to help you. The information you give to your doctor is like raw materials used in building a structure. Give out every correct information, even the one you think is not important. That may even be the one that will answer the why for us. Prepare for questions like, when did you start seeing your menstrual flow? How many days does your menstrual flow last? How long do you stay before another cycle will happen, like the cycle length? Do you experience extreme pains during your menstruation? Does it take you too long before you see your menses? Are you adding weight? Do you have hairs on some part of your body? These are questions, Are you adding weight abnormally? at a rate you do not understand. These are things that can help and give us a link to the possible cause, okay? Then there are basic tests that are musts for you when you come to the hospital with infertility. Things like semen analysis, very important. It will determine the quantity and quality of the sperm. Hormonal profile or hormonal assays, very important. Ultrasound scan, you can do some special x-rays for the womb. This is what we call hysterosalpingogram, HSG. Want to check if there is blockage anywhere, if everything is all right. There are a series of tests that will be done for you, so please, you really have to be patient and prepare financially as well. And after all the tests, treatment will be started based on the problem that was identified. There are many great options for achieving pregnancy these days. With advancements in medical practice, a woman can carry a baby in her womb even after she has reached menopause. We hear stories like a 60-year-old woman delivered a set of twins. You know, this has been able to happen because of the latest technology in medical practice, like the IVF method and all that. And not all cases of infertility require IVF. Some cases require tablets or hormone replacement therapy, you know, to correct hormonal imbalance. Like a couple I shared their story at the beginning. What will help you achieve pregnancy? Maybe a little change in lifestyle. So please come to the hospital for help. So as a couple, work together as a team. Go for hospital visits together. Please don't let the woman do it alone. It's psychologically draining. Carry out the medical advice together. Maintain healthy lifestyle in general and try your best to remove worries and anxieties from your lifestyle, and soon you have your good news to share. So it's Christmas season, and remember to make a wish. What do you want for Christmas? In my own case, I know what I want. I have just one wish today, that every family hoping to have their own children will hear the cries of babies in your home, and your joy will be complete. Merry Christmas and a fruitful year ahead. And if you're watching this health talk when it's not Christmas, my wish is still same, that every family will have their own children and you hear the cries of babies in your home and your joy shall be complete. Send in your questions and comments. I'll attend to them as quickly as possible. And if you're yet to subscribe to our channel, please subscribe and join us to stay informed. Like and share the videos to help others stay informed as well. Remember that with the right information, you are sure to make the right decision. Once again, it's your favorite health tech personnel on YouTube, Dr. Julia Naomi. Thank you very much for tuning in to learn, and see you again. I love you all.